Perfect. Thank you, Mary. And thank you all for taking time out of your busy schedules and lives to be here this morning. I think that that's a testament to who you are as people and that you care for and take care of and are in your lives that are affected who experience autism. And I think that as we're talking today, I think Mary said something really important, which is that this is an all teach, all learn model. So, we are speaking as kind of what we do in the fields that we function in, but also you're experts in the fields that you are. And I think that we want to learn from you, just as this is a mutually learning, it's a mutual experience. And so I think that we want to hear about what you're going through and kind of questions that you have. And that, as Mary mentioned, will be what we use to guide our curriculum. So today because of that, we're going to start with what autism is and what is autism. So, I think that what I want to talk about today is really to understand the prevalence of autism, or I should say, what is known about the prevalence of autism, as well as the definition according to the diagnostic and statistical manuals. Because there's a lot of information out there, but there's also a lot of misinformation. And I think that we also want to talk about within that, what's our consideration for the next best step in supporting children with developmental differences, including autism, in the educational environment. And something that I'm going to speak to as well is that we will tend to be using identity first language, and we can share kind of what that is and that experience, but you'll also hear me lapse into person first language because that was how I was trained. And so old habits die hard. So this is what's known about the prevalence of autism. So, the World Health Organization describes that about 1 in 160 kids are identified as having autism throughout the world. Within the United States, this is counted by the Centers for Disease Control and Prevention, and our estimated prevalence is 1 in 44 children. In the state where I live, so a lot of times this equates to approximately 1 to 2% of the population. And in the state that I live, the estimated prevalence is about 3% of the population. Looking for statistics within North Macedonia, was not able to find them, but saw like a neighbor to your south that was 138 children. And I think in line Mary was describing earlier, when we're thinking about what's our role and what's our voice in standing up for our colleagues and our fellow citizens in the world, it's estimated that approximately 1% of the population in Ukraine is described as being autistic. And so this is an estimated 440,000 individuals. So when we think about the conflict and trauma of war and what that brings to people, when we think about individuals where structure, routine, therapy, supports are particularly important, I think this is a unique and more intense form of trauma that they're going through. And so I think I think just something to keep in mind. The current state of access, I think is one that's defined by, we know that early prevention matters. So I'm excited to see therapists and teachers and NICU doctors on this call, because we know that specifically when kids are identified as having any developmental difference early and they receive therapy, their parents receive support, we know that that makes a big difference for how they do into adulthood. However, that's hard to do, right? Which is why one of the big reasons why we're in a call like today. And, I think that oftentimes families are left to figure this out on their own. There's not, because there is a dearth of specialists, there's not great navigation in terms of doing that. And so I think that this is an effort to address that issue. And I think resources are expensive, right? Therapy is expensive. And I think that, what I heard from you on our last echo, which I thought was very poignant, was that, because there's not enough speech therapists, occupational therapists, behavior therapists, special education teachers, oftentimes you, in whatever discipline you practice, you're functioning as all of those all at the same time. And so I think that we want to make sure that we're giving you strong evidence-based information so you can do the best for the kids that you're providing therapy for, that you're supporting in whatever capacity. I think what this results in, where there's a higher prevalence of a condition, when there's a dearth of specialists, this results in a lot of bottlenecks, right? So There's bottlenecks at intervention or at diagnosis, forgive me. There's bottlenecks at therapy, so intervention. And then on top of that, you add the pandemic, you add world conflict, and I think that adds an additional one that has to be dealt with first, right? Because we're functioning at a level of safety. But I think that we're entering a chapter when we're thinking about what development looks like for children and what family support looks like, that needs to keep all of these things in mind, and a new model is needed, which is what we're doing in a clinic like ECHO. So let's start with what is autism. And I think that when we're thinking about what autism is, we need to start with what autistic individuals describe autism is. And I think that the Autistic Self-Advocacy Network is a foundation that specifically is run by autistic individuals. And so one of their key mottos is nothing about us without us. And so ECHO is a model that includes autistic individuals, that includes families who have autistic individuals as primary voices at the table. And I think that's a critical element. And so I want to read this definition of what autism is by one of those individuals. Autism is a mental disability, and disability is a natural part of human diversity. Autism is something we are born with and that shouldn't be changed. Autistic children should get the support they need to grow up into happy, self-determined autistic adults. Isn't that why we're here, right? So I thought that was a very something to keep in mind as we're thinking through the lens of what do we do to support kids, adolescents, adults, and professionals, but particularly in families. So I want to back up a little bit, because I think this is something that I hear about on a daily basis in terms of like what type, like when families ask me, what type of autism does my child have? And I think that this is a lot of times informed by what's online, right? But I think that we need to back it up in terms of what autism was described as before 2013. So autism was described as one of the pervasive developmental disorders. And within that, there was autistic disorder, there was Asperger's syndrome, there was pervasive developmental disorder not otherwise specified, there was Rett syndrome, and there was child disintegrative disorder. And that specific diagnostic classification was informed by what the research showed us at the time. And so the problem with that is that a person like me could see a child and diagnose them with autistic disorder. A psychologist could see a child, the same child, and describe them as having pervasive developmental disorder not otherwise specified. And then another professional might see them and say like, hey, I think you might have Asperger's syndrome. And I think that, so what that tells us is that it was a classification system that did not allow us to accurately describe what was going on in terms of how a child was experiencing the world and what their learning strengths and challenges were. Rett syndrome, for those of you who have not heard of it, is actually been classified as a specific genetic syndrome. There's a genetic marker that's associated with that diagnosis, and so therefore would not be appropriate to think about in terms of a behavioral description such as autism. And I think the other piece with Rett syndrome is, typically you'll see a child who is showing typical developmental milestones, and then their head circumference starts to stagnate in terms of growth, and they start to lose skills. But over time, what you tend to see, and again, I'm generalizing, and this is not, there are always exceptions to this rule, is that social engagement would be a relative strength. And so that's different than what we're thinking about in terms of a learning profile such as autism. So there were three specific categories. So there was communication, social interaction, restricted interests, and stereotyped behaviors. So then fast forward to 2013. And what happened was all of these descriptions were subsumed into autism spectrum orders. And there's also debate about, the language that I'm using, right? And so that's why I want to be careful about what I'm describing. I'm describing kind of what is known, but there's also, and we can share this with you, there's folks that will talk about autism spectrum is not a disorder, it's a condition. Some people will dispute that and say that it's actually, as I mentioned before, we're talking about self-advocates, they'll describe it as part of neurodiversity. And so I think that But then you'll also hear another side of that too, when families are caring for kids who have significant behavioral and developmental issues, that neurodiversity does not ring true to them either. So I think that the bottom line is that we need to have respect and compassion and understanding for how these things are described, but I'm also very aware of how the medical system can be problematic in terms of how we use our language. So I think when we're thinking about autism spectrum disorder, it was subsumed into this one specific description. But then, instead of 3 categories where we had communication, social interaction, and restricted and repetitive behaviors, what the research showed us is that it's more accurate to describe it into 2. So social communication, restricted interest, and repetitive behaviors. And then that, if we're thinking about what needs to happen. So a couple things. So in terms of the social communication category, a child has to meet all 3 of these. So there has to be difficulty with back and forth social interaction. There has to be decreased use of nonverbal communication, such as eye contact and gestures. There has to be difficulty in developing relationships according to their developmental level, and particularly with peers. So again, you have to meet all 3 of these social communication criteria. And then when we're thinking about the second part of the diagnosis, you have to meet 2 of the 4 within the restricted interest and repetitive behaviors. So there could be repetitive language, play, or motor behaviors. There could be difficulties with change or insistence on doing things in the same way. I think this is the lens through when I think about with the pandemic, with war, with all of those things, this can be particularly intense and disruptive for kids and individuals. There could be specific and intense interests. There's also sensory differences. You need to meet 2 of those 4. So again, all 3 of the top, 2 of the 4 of the bottom. And I think a piece that I think is also critical to this discussion is it's not an absence of social communication, it's a decrease. So a lot of times people, and I'm saying this because of what family feedback I see from families, is that they'll say, but my child makes eye contact. Absolutely. But my child has better social interactions with me than they do with you or with the therapist or the teachers. Absolutely. But that's the deficit, that's the decrease, right? So, and it's not necessarily that an individual with autism doesn't make contact, it's how they use their eye contact to modulate social interactions, right? So I've had to learn that when I'm giving a talk on Zoom, I need to look at the light, not the screen, right? Which is very disruptive for me. But I think individuals with autism also will need to specifically learn how to use their eye contact. And that's a lot of what you're doing with your therapy, right? That's a lot of what you're doing with school, right? Is teaching them, number one, the abstract concept of language, also specifically teaching how communication is a reciprocal experience. And so I know and acknowledge that that's not an easy thing to do. So I think what you're doing as teachers, as therapists, is critical, and your work really matters. And so we want to make sure that we're providing you tools to do that effectively and with what we know is evidence-based and best practice. So all that to say, right, there's these categories, right, that I've just described, but autism looks different in every single person. I've never met an autistic person who has the same pattern of learning, the same pattern of strengths and challenges. I think the commonalities are that decrease in social communication and those restricted interests and repetitive behaviors. I think that's why I think it reflects what we don't know about the brain, right, and how neural networks work. I think it also reflects the fact that this can be incredibly confusing to talk about with individuals, with families, with professionals, because it looks so different. And so I think it's a very humbling experience as well. So when we're thinking about a first step, right, I think that the feedback we received is that you'd love to see a checklist to see what are specific things that we should look for in our interactions with kids where we should be thinking about autism. And I would back it up just one step. I think that really what developmental tools are devised to do is to understand where a child's strengths and challenges are within those streams of development. And we're going to go deeper into this over our teleclinics, but thinking about cognition, communication, social emotional development, adaptive skills, behavior, and motor. So one specific tool that can be helpful that is actually a global developmental screening questionnaire is called the Ages and Stages. And there's also the Ages and Stages questionnaire, social emotional, and many of you might probably use it or have heard of it, but it's one that's given to parent and caregivers. It's for kids who are between the ages of 2 and 66 months of age. It takes about 12 to 18 minutes to complete. It also has strong psychometric properties as a screening tool. So there's 87.4% sensitivity, 95.7% specificity. Behind all of this, and I think important to understand, is that parental report of developmental milestones has been shown to be a valid way to follow them over time. And so I think that otherwise these screening tools wouldn't work, right? And so I think that when we're acknowledging families and parents as experts for their children, I think it's really important to keep this in mind, is that these tools, to me, are tools to identify when do we need to provide a child extra support with or without a diagnosis. I think another piece that's part of this is that it's also about identifying with families, helping them understand, like, how is their child developing and what are the areas of support that we need to provide. And I say that because I think there's a lot of pressure about diagnosis, right? Like, how do I take care of a child if they don't have a diagnosis? Well, when there's a dearth of specialists and there's all of the host of issues that are happening, we need to be able to function without one. That's not popular in the world that I'm from in terms of, in many levels, but I think we have to think about it differently. And until a child's able to get a diagnosis or a family is ready to think about a diagnosis, it's a process, right? It's not a discrete event, it's a process. And I think that you as therapists, you as teachers have a big role because you see kids on a daily basis and you see parents. And I think being able to provide them with your expertise on what you're seeing and how a child learns and where you see the challenges, I think is really powerful. This is one tool to think about with that. And I think that there's been a lot of validity and evidence with this specific questionnaire in multiple languages and cultures, including North Macedonia. It's been shown to be useful in multiple settings, including schools. And it also provides learning activities for families to implement at home. Something I think about when I see the results of this questionnaire, and it's been a long road to get primary care physicians to get to them to implement this in the United States. And I think that there have been efforts to implement this in daycares, to implement this in schools. And so I think that's actually where it's been very powerful, is getting the feedback. A lot of times families will say, my child's teacher had me fill this out and said, hey, this is something that we need to look into further. So I think that has your relationship with families and your expertise carries a lot of weight and a lot of importance. So this is, I'm getting a little going off on a tangent here, but I think it's just something important to think about, is that that's also an important element. When I look at this questionnaire and I see where a child's cognition is, and then I see a relative weakness in social emotional development, that's when I think that's something that's supportive of, we might need to be thinking about autism. So just a thought. So in summary, autism is a developmental condition. It affects social communication and behavior. It looks different in everybody. And I think that that's a humbling piece of it. It's a confusing piece of it. And it's also something that we need to be aware of as individuals. Clinicians, educators have a huge role in supporting families as they learn about their children's development, including when it may be happening in a different way than we expect. The Ages and Stages questionnaire is one tool to build understanding about a child's development, and what Mary and I will provide to you is specifically the research study that supports that for use in multiple languages and cultures. We'll provide a link to the Autism Navigator website, which is one that provides a list of specific symptoms to think about when autism might need to be thought about within the preschool age group. And then we'll also provide you with some additional ideas for things to think if it might be useful to you in your environment. So thank you so much for your attention.
Sarah, thank you for your presentation.